Nina, could you please share the slides? Thanks a lot. And because we will do that, we see we're a collaborative and interdisciplinary team, and for this reason, we decided also to have the joint forces also for this presentation. Yeah, the project title is Healthcare Organizations Resilience in the COVID-19 Crisis, COVRES for short. And as you can imagine, it's on a very highly important topic, highly relevant and ongoing topic that we want to shed new light on. Next slide, please.
Sorry. No, yes.
Great,
sorry.
thank you. Yeah, as indicated, it's a great team, a great disciplinary team, not only within the business school. Two institutes are here involved, the Institute for Leadership and Change Management being the host institute, but also beyond the business school, especially with the Cook, the Kepler University Clinicum, and also another partner, Technical University of Chemnitz. And yeah, with that, having opened the floor, the bigger picture, I want to give the word to my colleague Nina to tell you a bit more about this great project.
Thank you. So our project addresses the issue of how healthcare organizations manage major unexpected crises and how this is affecting their resilience. Hereby, we define organizational resilience as the ability of an organization to anticipate trends and threats, to cope effectively with unexpected events, and to learn from those. The current COVID-19 pandemic is perfectly suited for an in-depth analysis of this issue. In order to examine the phenomenon comprehensively and from a multi-perspective, and to address our guiding question, why and why not did healthcare organizations collapse in the context of the COVID-19 outbreak, we adopted a predominantly qualitative approach. In order to understand resilience of healthcare organizations and to generate relevant insights for theory development, organizational practice, and society, we conducted expert interviews in hospitals in the early 2020 with members of medical and nursing staff, hospital administrators, and other key persons responsible for the coordination during the crisis, as well as external stakeholders such as consultants, service providers, and other experts in the three European countries, namely Austria, Germany, and Switzerland. And in addition to these expert interviews, we analyzed archival data in form of newspaper articles on COVID-19. The observation period here covers the whole year 2020. We included 3 national newspapers, namely the Zeit for Germany, the Standard for Austria, and the Neue Zürcher Zeitung for Switzerland. Our main goal here was to understand what influences the resilience of healthcare organizations on a broader level. In addition, we also considered factors that potentially influence the situation in healthcare organizations, such as released protection measures, societal reactions, or political decisions. So in spite of urgent warnings, the spread of COVID-19 has caught Europe totally unprepared, whereby the extent of the crisis cannot be estimated at the present. Being in the center of the COVID-19 pandemic, the current crisis seems to push our healthcare system to the edge, whereby the crisis clearly points out the weaknesses we already knew about even before. For instance, staff shortages, as well as insufficient digitalization. Moreover, and despite detailed warnings from the World Health Organization of a global influenza pandemic, Ebola, or an unspecified unknown disease, and the risk of a bioterrorist attack, hardly any European healthcare system and its various organizations, such as hospitals, were really prepared to deal with such an event. The underestimation of the SARS-CoV-2 outbreak has not only shown a lack of anticipation and preparation, even worse, most countries did not even use the summer of 2020 to thoroughly prepare for a possible second wave. Many factors play a role when it comes to manage a crisis. In this context, not only researchers, but also practitioners are interested in understanding how healthcare organizations and their members cope with uncertainty and how they can become more resilient. By examining resilience of healthcare organizations from a multi-level perspective, we aim to contribute to what can be framed as one of the grand challenges that confront our species. Moreover, since this crisis is unlikely to be the last global pandemic, we derive useful implications for healthcare practice. Now, Charlotte will tell us more about the theoretical motivation for our project.
Yes, thank you, Nina, for your explanations. We now want to present you the motivation for our project from a theoretical point of view. From previous research, we know that healthcare professionals, especially middle managers, have a high risk for developing stress-related psychological diseases, for instance, burnout, whereby constant stress can favor physical and psychological impairments, for example, sleep disorder, and negative coping mechanisms, for instance, substantial abuse. We also know that these stress-related psychological diseases, such as burnout, can have a negative spillover effect. Along this line, healthcare leader stress can, on the one hand, lead to negative effects on patients, for instance, through treatment errors or misdiagnosis. And we know that this is really an alarming topic in healthcare organizations. On the other hand, leader stress might also have a negative influence on their teams and their employees, for instance, through a negative work climate or missing support, which lead to negative effects on the patient again. Therefore, the stress and high risk for developing stress-related psychological diseases of healthcare professionals, especially leaders, might have, through a trickle-down effect, a negative influence on the healthcare organization as a whole, particularly when it comes to the capacity to react to unexpected events and crises like the current COVID-19 crisis. In turn, we also know that from organizational crisis literature that leaders have a crucial role when it comes to managing organizational crisis and uncertainty. And therefore, we think that examining the role of the leader for healthcare organization resilience might be a promising starting point for understanding why or why not healthcare organizations did collapse in the context of the COVID-19 outbreak. Could you switch the slide? To investigate why or why not healthcare organizations did collapse in the context of the COVID-19 outbreak, we need to consider previous research from different fields. First, since we aim to investigate healthcare organizations' resilience from a multi-level perspective, we need to consider research on individual resilience, in particular on leaders' resilience, as well as resilience research on organizational. Further, because healthcare organizations are part of a broader healthcare system, as well as embedded in society, we need to take a closer look on the specific institutional context. Along this line, we also consider research that has been done on healthcare organizations in general, as well as on leaders and teams. Furthermore, derived from the context of healthcare organizations, we also took a closer look on research on high reliability organizations and high performance teams, although healthcare organizations are not per se high reliable organizations, there are several insights that are useful when it comes to healthcare organizations' resilience. In the sense, both kinds of organizations, in both kinds of organizations, small mistakes can have a huge impact, for instance, the death of a patient. In addition, since the current COVID-19 crisis can be framed as a grand challenge, we also considered what it means to operate, under the threat of a grand challenge and what we can learn from this one for managing other grand challenges, for instance, the climate change. Since these grand challenges probably lead to organizational crisis, as the current COVID-19 pandemic has shown us, we also derive some important insights from managing organizational crisis in general. Next slide, please. Derived from the broader research question, why or why not did healthcare organization collapse in the context of the COVID-19 outbreak, we are currently working on 2 specific research papers. First, based on the knowledge that leaders are crucial for managing organizational crisis, we aim to investigate the role, or we are investigating the role of leaders for healthcare organizations' resilience, whereby we frame the current COVID-19 crisis as the broader context. Second, we are aimed to investigate organizational resilience during crisis in practice, which with the aim of a case study approach, which will start in summer. Next slide. More specifically, with our first research paper, we use Duchek's model of organizational resilience as the foundation of the resilience of healthcare organizations. Here, organizational crisis is captured as 3 phases: before the unexpected event, during crisis, and after the crisis, leading to 3 crucial elements of organizational resilience, namely anticipation, coping, and adaptation. While the first phrase, anticipation, occurs before the actual crisis happens, and primarily comprise the ability of a company to scan the environment, identify critical developments, and prepare for potential crisis. The second phase relates to coping with the actual crisis situation, and the third phase, final phase, adaptation, relates to the post-crisis period. Here it is important that the organization reflects on the crisis, learns from it, and implements knowledge to be better prepared for future crises. So within our phase paper, we are considering the leader's role during these specific phases and how the leader is affecting these 3 elements. Yeah, next slide. So thank you for your attention and interest in our research project. Please do not hesitate to ask any question. We are here.